You might not be sick, but you do not feel well either. You wake up tired. Your joints feel stiff. Your brain feels slower. Your energy drops without warning. And every lab test says normal. That disconnect is frustrating because something feels off, but nothing looks wrong. Let's talk about low-grade chronic inflammation. Not a swollen ankle, not a fever, the quiet kind, the slow burn. Inflammation is not the enemy. It is protective. It helps you heal and fight infection. The issue is not activation. The issue is resolution. Inflammation should turn on and then turn off. When it does not turn off, it becomes background activation, and background activation drains energy. Your immune system consumes resources when it stays slightly active. You feel fatigue and brain fog. Immune cells release signaling molecules called cytokines. Helpful short-term, draining long-term. They influence mood and sleep quality. That is why inflammation does not just affect joints. It can change how you think and feel. Low-grade inflammation often does not spike dramatic lab markers. Nothing screams emergency. It whispers imbalance. Common drivers include poor sleep. Deep sleep recalibrates immune balance. Fragmented sleep raises inflammation. Metabolic instability is another driver. Repeated glucose spikes increase oxidative stress. Oxidative stress amplifies inflammation. Chronic stress also shifts immune signaling. Burnout becomes biological. Low movement contributes. Muscle releases anti-inflammatory compounds when it contracts. Sitting removes that signal. Excess visceral fat adds fuel. Abdominal fat releases inflammatory chemicals. More inflammation worsens insulin sensitivity. The cycle reinforces itself. You cannot detox inflammation, you regulate it. Regulation requires rhythm. Start with consistent sleep timing. Prioritize adequate protein, increase fiber intake. Strength train 2 to 3 times weekly. Walk daily, especially after meals. Get morning sunlight to anchor circadian rhythm. Practice stress regulation. Not every symptom equals inflammation. Fatigue can be anemia. Thyroid imbalance. Sleep apnea. Vitamin deficiency. If symptoms persist, work with your clinician. Use appropriate labs to guide decisions. Here is the empowering part. Your body is adaptive. When you change rhythm, biology responds not overnight, but predictably. Chronic inflammation builds slowly, but resilience builds the same way. Slow and steady, through repetition. You do not need extreme. You need consistent. If this helped you connect the dots, share it with someone who says, I just do not feel like myself. This is educational information only. It is not medical diagnosis or treatment. Always consult your healthcare professional for personalized evaluation.